Good morning. This is Dr. S. Prince Samuel, working as Associate Professor in the Department of Biomedical Engineering at SNS College of Technology, Coimbatore. SNS College of Technology is the first Indian institution to implement the design thinking framework in the entire curriculum. Now I am going to discuss about the business canvas model of a Y Combinator startup company named Vera Health. It is in USA. Along the students are also going to explain about this business canvas model. This Y Combinator company mainly focuses on the solutions for the patients, especially the monitoring of patients, because nowadays this monitoring of patients becomes a very vital task for the doctors as well as the patients, because everything needs to be automated. The AI has to be integrated along with this monitoring, then it will become easy. So there are many startups working on this solution, but this company has provided a good solution based on the customers' feedback, the key segments, the stakeholders' feedback, and they have developed into a very good product. Let's start the discussion now.
The company name is Vera Health and the business model Canvas overview. And first we focus the value-based primary healthcare service, and the main target is employers and employees. And the goal is to improve the health outcomes while reducing cost and approach preventive care, digital tools and care teams. And this company uh, mainly focus on the patients to rescue them, and that helps to monitor lots of diseases, disorders, etc.
So I'm going to be talking about the business model Canva of the Vera startup company. So basically, this startup company develops software. So they are developing a monitoring system where they can monitor the patient's vitals like ECG and blood pressure, heart rates, and etc. So the business model Canva is really essential for the company, and it's essential for us to understand how it actually works. What are the revenue, how are they working, and all of that. So first off, we are going to be seeing about the uses of this system. So that comes under the customer segments. So the people who will use this would be high risk stroke patients, and the people at the hospitals and clinics, caregivers, EMS system people, and the companies which runs under the insurances and all. So value proportion. Coming to the this segment, so what it actually detects, this is called as the value proportion. So it detects early stroke detection. So it has AI-based EEG monitoring, and it actually gives the emergency alerts, and it also provides peace of mind. So coming to the channel part, so where it actually is in use is direct hospital sales, online distribution, conferences, and a lot of medical distributors also use these. So like they also connect this in the digital platforms. Coming to the customer relationships, um, how it actually works is we can use this under the subscription updates and clinical onboards, remote monitoring, and by using the technical support also we can see the relationship between the customers and the user. And how this system generates this revenue is by the device sales, subscription model, licensing, licensing to the hospitals, and data analytics. So the key resource of this business model Canva of this system would be AI algorithms, wearable hardware, clinical validation data, and the regulatory approvals. And coming to the key activities would be AI training, R&D services, manufacturing, regulatory compliance, and marketing. And the key partners of this would be hospitals, clinical researchers, distributors, and insurances. So the overall cost structure would be from manufacturing industries, clinical trials, marketings, customer supports, and finally would be the R&D costs.
So I'm going to tell about the technology and AI stroke detections. So EEG based neural monitoring is it monitoring the brain activities which is abnormal activities or happened in the brain. So the EEG is based neural monitoring is detect the abnormal activity of the brain and it detect and give the informations. Okay, next one is the machine learning algorithm. So machine learning algorithm and artificial intelligence, these are all collect the data and it store the data. So uh, it store data in EEG based signals. So next real-time data processing. The real-time data processing means so here we process the data. So for example, we taking the EEG signals in neural monitoring means here it will monitor the brain. So in real time, it process the data and give it. Next, automated emergency alerts. So what is automated emergency alerts means? It give the alert to the doctors or their hospitals if anybody suffer or if it is abnormal in brain, it will get stroke means it is automatically it will send the alerts, emergency alert to a doctor, the hospital or the main specialist. So this all our informations is passed through in mobile applications or in hospital monitoring systems, so or alerts like alarm. So this is automated emergency alerts. Next, cloud based analytic means it will store the data. It will first collect the data from the patients and it will store the data very safe and securely. Next one is data analysis. So final one is data analysis. It will analyze the data and improves the stroke. So improves the stroke detections in the brain. So these are the technologies and AI stroke detections.
Thank you, students. We had a wonderful discussion about the business model company named Vera Health.